Good afternoon, beautiful citizens of the Borderland. This is 915 Talk, and I am your host, Andy Frecka. And it's March 12th, year of our Lord 2025. We are live from the heart of the world's largest borderplex, the KELP studio here in El Paso. Kenny on the board, how are you doing today?
Yes, sir, I'm doing well.
Yeah, and you know why you're doing well?
Okay, I'm going to follow where you're going with this. Yes, because I've had my mouth taken care of.
Yes, you have had your mouth taken care
And
of.
actually, that is a very true statement. I have noticed a difference.
Okay, yeah. So, where is your favorite place to get your mouth taken care of, Kenny, on the board?
Well, there's one place that literally saved my life, and one place that was tremendous. Also, well, I don't remember the life-saving one because it was surgery, but the other one I was awake for that, and that was a great place to go. The people were super friendly at 7 a.m. in the morning, freezing cold, and they were all smiles and giggles.
Okay, and what place was that?
That was High Desert Oral Surgery, and that was the one on Cimarron.
They saved your life?
No, that one was Dr. Yates. He pulled 2 teeth back in January. The ones that saved my life was here on Gateway.
Okay.
And they did emergency surgery. They also pulled 2 teeth, had an infection in one tooth, and it actually spread across the entire width of my neck and down my neck.
Wait, when was that? When was that?
2022.
2022, you're at High Desert. Okay, so...
Yeah, they came over to... what is that, Sierra? No, not Sierra. Del Sol.
Okay.
Del Sol Hospital, and they did the surgery there.
All right, so High Desert Oral and Facial Surgery. And,
yeah, great people.
And I think what our listeners got from that is High Desert Oral and Facial Surgery is great people, but also you don't have very many teeth left. I'm sorry to hear that.
No, I still got some. I can chew steak.
but you have your life, so that's good.
Yes.
Mac Daddy Del Norte, have you ever had any teeth pulled?
No, not yet. Thank God.
It's because they don't do that at McDonald's.
Yeah. Do you need any teeth pulled, Mac Daddy?
No, not at the moment.
Okay, you're practicing good oral hygiene. You seem like you're doing well.
Yeah.
Well, if you ever need a tooth pulled, we're going to be talking about that today. But we're also going to be talking about a lot more because at the beginning of 915 Talk, what we say is the world is looking at El Paso. What will we say to the world? But there's a lot of things going on in El Paso that people in El Paso don't know about, and they're actually pretty cool. What's going on?
Yeah, we've got some good stuff going on.
Yeah, so every day we get together on 915 Talk and talk about those things. On Monday we had TxDOT here, and we found out that after they finish I-10 on the west side, they're going to do another 3 years on the west side on I-10. And then yesterday we had District 1 Representative Alejandro Chavez with us. Last week we talked about elder care.
Yes.
Yeah, we're on a learning journey, Kenny, on the board, and I also feel like Mac Daddy Del Norte is kind of getting a little bit of a higher education here on 915
Oh,
Talk.
definitely.
That's
right.
Yes.
Yeah, I hope with the rest of our listeners, we're kind of getting a good education, and we have a special guest today. Do you know why he's a special guest, Kenny, on the board?
Our guest is special because he's a. Darn it! Now my tongue.
Okay, I got it.
Can you say it, please? My tongue got tied.
He is the unique expression of an endlessly creative God.
Thank you.
That's absolutely right. But he also has.
I told you say it better.
Yeah, he has a great education even without 915 Talk. That's kind of amazing.
Okay.
I'm not going to read the whole thing. Because that would take up the entire program. His education only.
Wow. Amazing.
But Louisiana State University. He was at the Providence Care Center in Portland, Oregon, and the University of Miami. He served as an associate professor of surgery and program director of the Head and Neck Oncology Fellowship at the Miller School of Medicine. He was born outside of the United States. We're going to get onto that. But then after spending some time in all of these institutes of higher education, he ended up in the beautiful city of El Paso. Nice. So we're going to find out about his journey here. We're going to find out what he's doing because, I know Mac Daddy Del Norte is working out every morning, and as is Kenny on the board. But, some people say, well, I was working out today and I had leg day or I had chest day. But I just heard today for him was neck day. So I don't know what that means, but we're going to find out. So without further ado, let's give a very warm Borderland welcome to the one, the only, Dr. Arshad Kaleem.
Thank you.
Dr. Kaleem, welcome to 915 Talk.
Well, thank you so much for the invitation.
Yeah, so you were already at UMC today talking about what's going on. It's been a day of just traveling around talking about what you're doing. So I hope you're not too tired for this.
No, I'm okay. Well, thank you so much for the invitation.
Yeah. So, Dr. Kaleem, what does Neck Day mean? Today was Neck Day.
Neck day?
Yeah.
I don't know if it's a neck day.
That's what I heard when you came in. Today was Neck Day for you at work.
Oh, it was head and neck cancer clinic day.
Oh.
Oh, yes,
Okay.
yes. So we have a specific day of the week where we do our clinic.
Uh-huh.
And Wednesday happens to be the head and neck cancer day where we see all the patients with head and neck cancer. So it's our follow-up, new patients, and post-op. Yeah, so that's what we had today.
Okay, so
Yeah.
Head and Neck Day.
Yeah.
All
So
right.
we call it head and neck day. So
Okay.
it's because we do a lot of different procedures and we see a lot of patients. But this day, Wednesday, at our Cimarron office is totally dedicated to the head and neck cancer patient population.
Okay.
Yeah.
So what kind? I don't know anything about head and neck cancer.
Mm.
So are we talking like tumors that you're working on, or like explain this to me like you would explain to someone just like me who doesn't have the education that you have?
Yeah. Well, so head and neck cancer is basically any cancer that comes that arises in the oral cavity, tongue, mouth, lips, throat, like thyroid cancer, larynx cancer, cancer, anything in the head and neck area.
Okay.
Is basically we call it head and neck cancer.
Right.
Below the skull. I mean, if it's in the brain, it's addressed by a neurosurgeon.
Right.
But anything between the clavicle and the base of skull, any cancer of that sort is basically head and neck cancer, and we treat that.
Okay. So I believe that the only stupid question is the one left unasked, and that's kind of the motto of my program, 915 Talk. But I don't know if I've ever met anyone who had that type of cancer, but I guess it's widespread enough, and you're dealing with it every day, every week.
Right. I mean, head and neck cancer is a very common cancer. I mean, of course it's not like breast cancer or lung cancer, but if you this part of the world, but if you look at it in like Southeast Asia, for example, India, Pakistan, Bangladesh, Sri Lanka, that area, and China, head and neck cancer is very prevalent and very common.
Huh.
Yeah, but here in the States, it's also very common, but not as common as breast cancer or lung cancer or prostate cancer.
Okay.
But yes, I do deal with head and neck cancer every day. That's my job, and that's basically my specialty to treat patient with head and neck cancer and also then rehabilitate them, meaning then reconstruction. Because whenever you have cancer in head and neck area, let's say you have cancer in the mouth,
Right.
you remove the cancer, you are left with a defect, right? And then we have to create a tongue or a jaw so that they can function, they can speak, they can talk, and also aesthetically they can look normal. So your job is half done if you remove the cancer. The next job is to reconstruct them and rehabilitate them and put them back in the society.
Well, I'm already concerned that we're not going to have enough time to dive into that, but let's give it a try.
Yeah.
So tell me about reconstructing the jaw.
Yeah. So once the tumor is removed, I mean, of course, the jawbone is removed and the teeth are removed, right?
Okay.
So now we have to reconstruct it, and we have different options. And one of the most common option nowadays that we use, and it's the most reliable option, is we call it free tissue transfer, meaning that we take tissue from the body, like a bone, and in this case, most of the time, we'll take bone from the leg. And
Okay.
it's called a fibula bone. It's a smaller bone. There are two big bones in the leg. It's the shin bone, and behind the shin bone is the smaller bone, the fibula bone.
Okay.
And we take that along with the blood vessel. It's kind of like a transplant from one part of the body to another part of the body in the same patient. And we transfer it to the head and neck area, and we reconstruct the jaw with it, and then the vessels that comes with it, we suture it to the vessels in the neck, so that this bone is getting its own blood supply, and it's a living tissue, so that it can grow, it can remodel, and it is not rejected by the body.
Wow.
Yeah.
Wow. Okay. Before we go any farther into that,
Yeah.
I'm reminded that I do need to say the information on this broadcast, 915 Talk, is for informational purposes only. Because Kenny on the board was thinking of going home and taking out his own fibula and reconstructing his jaw. Don't do that.
Yeah.
Nothing on this program is to be construed as medical advice. Always consult your licensed physician before making any health-related decisions, as every situation is unique. And this broadcast is not to be construed as medical advice. So I don't want Kenny on the board and Mac Daddy Del Norte.
Don't try this at home.
Do not subscribe to the Time Life Book of Home Surgery. You need to go to a lot of college and talk to a licensed physician who knows your situation. So
Fine, I'll keep my tibula.
yeah,
Right where it is.
Fibula. Were you even listening? There's a femur, the tibia, and the fibula. So,
So I would have really been messed up.
so Dr. so Dr. Kaleem, allow me to again ask the dumb question. Is the fibula like the appendix of the skeletal system, like the unneeded bone in our body?
Well, I wouldn't say it's not needed. It's, of course, every part, every tissue in our body has a role. But the thing is, it's not a weight-bearing bone.
Okay.
And you can get away with without having the fibula.
Okay.
Yeah.
I can get away. If you took out my fibula, what are we talking here? Can I run sprints? Can I run a marathon?
Yes, you can. We have patients who have run marathons after this surgery, but it will take some time and some training.
Okay.
Yeah.
Okay, so you take out the fibula, but first you had to remove the tumor in the jaw, and so the person does not have a jaw. And then you reconstruct the jaw with the fibula.
Yeah.
I'm doing well so far.
You're
right?
doing really
right,
well.
doctor?
It's not the tibula, it's the fibula.
Yeah, it's Kitty on the board. He always gets his skeletal system mixed up. But then I guess you would have some prosthetic dentures put in on.
So you can do that. That would be a stage procedure.
Okay.
But we do it in one surgery. We remove the tumor, and then we reconstruct it in the same surgery. And it's a long surgery. It can vary from 8 to 12 hours.
So from the point you take out the tumor to the point where the bone is replaced in the jaw.
Yes.
Because the fibula now in the place of the jaw has to be fed by blood vessels.
Yeah. So because the surgery is very complex.
Yeah.
And usually it takes two teams.
Okay.
Yeah. One team is working in the head and neck area removing the tumor, and the other team, what we call the reconstructive team, they're working on the leg harvesting, which is the word we use to take out the fibula.
Right.
So they're working on that, and then it's a very complex surgery requiring a lot of time. Then we have to do the anastomosis, which is basically the word we use when we connect blood vessels together. We sew them together. Sutures and the stitch is basically almost like thin as a hair, and we do that under the microscope. So the whole process, preparing the patient, doing the surgery, taking the patient out of the operating room, it can vary from 8 hours to 12 hours.
Wow.
Yeah.
Okay.
Yeah.
Quick follow-up question. How do you reconstruct a tongue?
So to reconstruct the tongue, we do a soft tissue flap. So the fibula, the jawbone that we talked about, that's a hard tissue, or we call it composite tissue, comprising of bone and soft tissue. For tongue, it will be only soft tissue flap. And for that, we can borrow some soft tissue skin from the forearm right up here.
Okay.
It's called the radial forearm free flap. Or we can borrow tissue from the thigh. It's called the anterior lateral thigh free flap. So depending on how much the defect is and how much reconstruction we need, we decide which area of the body we have to take that soft tissue from.
Wow. So I just want to mention to our audience again, I think for a lot of people, we hear these kind of things and we assume that they're only being done in places like Houston or I don't know, L.A. or Chicago.
Yeah.
But this is happening right here in El Paso. Are these procedures done in most major cities around the United States?
It's done in major cities across United States,
Okay.
And I'm happy to be here in El Paso, and El Paso happens to be one of that cities.
Right.
Yeah, and the other thing is the training. The training, which it's a beyond residency. So if you do residency, you have to go beyond residency, get the training to do these kind of surgeries called a fellowship, which is an additional 2 years of training. And El Paso is one of the few centers in America which offers that training.
Okay.
Yeah, so it's pretty unique.
Okay.
It's pretty unique.
The
that
fellowship part, which is
exactly, we train physicians to be trained and specialized to do these kind of procedures. So it's
how is that? Is that at High Desert or is that at a hospital? Or how
so
does that work?
it's a partnership between High Desert Oral and Facial Surgery and UMC.
Okay.
So it's a partnership with them.
Okay.
And we have this head and neck cancer fellowship, basically as a partnership between these two entities.
So you have again a medical student who's completed all of their medical training, but to do these procedures, they need to have, I guess, on-the-job training. That's the fellowship?
No, basically before they've come and do the fellowship, they have to have done a residency. A 6 years or a 4-year residency training beyond medical school and dental school, and then they will do the fellowship.
Okay.
That's an additional 2 years.
And the fellowship is another
2 years.
2 years. Okay.
Yes.
Wow. Yeah. I again, that's why we say this program is for informational purposes. Don't try this at home.
So you're looking into at least 10 years of training.
Right.
Yeah.
Before they let you take out someone's fibula and put it in place of their jaw. Right. And then with the tongue, like you talked about soft tissue, that's not muscle. So there's still some muscle left in the tongue?
So most of the tongue is muscle.
Right.
Yeah. So it depends how much tongue you have taken out.
Oh,
So tongue cancer doesn't mean you take the whole tongue out.
Right.
Sometimes we do, which we call hemiglossectomy, meaning we take half of the tongue. Sometimes we take part of the tongue, which is called partial glossectomy, and sometimes we take the whole tongue out. It's called total glossectomy. So depending on how big the defect is and how much soft tissue is needed, then we make a decision of what kind of flap we need to do.
And you mentioned rehabilitation. I would assume, especially with the tongue, there would need to be some
There's
training
a lot of
for the
rehabilitation
patient.
that's needed.
Yeah.
Speech and swallow,
Oh, yeah, I didn't even
nutrition.
think of speech. Yeah.
And if we have taken a major part of the tongue out, then these patients are usually not able to drink and eat on their own right away. They have to be trained. They have to have what we call a stomach tube, feeding tube, before they get training into taking anything by mouth.
Wow.
Because they have to learn everything again.
Yeah.
Yeah, because and then surgery is just not the only thing that a cancer patient go through. Then they need radiation, and radiation is another
Wow.
kind of like a process. It has a lot of side effects, a lot of fibrosis, and most of the side effects and the complication patients have with eating and drinking, believe it or not, it comes from the radiation that they go through.
Oh.
Yeah.
Gotcha.
So it's like a whole process.
Wow.
Yeah.
Yeah. I can't even begin to imagine, but I'm starting to, I guess. That's amazing hearing all these things that are happening right here in El Paso. For those of you who are just tuning in, we're with Dr. Arshad Kaleem of High Desert Oral and Facial Surgery, talking about some of the procedures that are done at High Desert Oral and Facial Surgery. Really appreciate him coming in today. When we get back we're about to go into a break. When we get back, we'll be talking with Dr. Kaleem about his personal journey, how he ended up in El Paso. Also, later on in the program, we'll be talking about how he was in the West Bank a little over a year ago, and just hearing what's going on there, and from someone who was just there. So Let's go to break. Kitty on the board. Do not touch that dial.
We'll be right back. Don't touch that dial.
Each Christmas, the Las Cruces Gospel Rescue Mission continues to do its best to demonstrate the love of Jesus Christ to the poor and homeless of our city. Currently, we are in need of clothing, coats, blankets, hygiene items, shoes, and more. Visit our website at lcgrm.org for more information and to donate online. The Las Cruces Gospel Rescue Mission. We're not just a handout, we provide a hand up.
Together we help Las Cruces.
915 Talk is listener supported. If you believe that local Christian talk radio is important to our community, please take a moment to prayerfully consider taking part. For all donation options, including secure online giving, visit kelpradio.com and click on the Cornerstone Broadcasting link. Let's reach our neighbors in the Borderland together.
915.
Testify.
Probably 2011, I was going through a really rough patch in my life at that point for like 2 years. And at that point, I was out living on my own. Even though I was married, we were separated for like 2 years, just me and the dog. It's kind of funny sometimes when you're off by yourself and you realize just me and the dog, nobody else to turn to. You start turning to the Lord. I've messed up here. How do I fix this? Through trying to find some hope in the situation at that point that seemed hopeless. And it's especially the parts that I waited patiently for the Lord. Like I told you earlier, I think you could take the patiently out of there. I waited. I was not always patient, but the Lord works on His time, not on mine. And He did. He brought me up out of the pit of destruction and out of the miry clay, which He did. He brought me up out of a lot of stuff, got a life turned back around, saved a lot of things in my life besides just me. I'm Keith Terrell, and if Jesus did this for me, He can do the same thing for you.
And they overcame him by the blood of the Lamb.
And by the word of their testimony.
KELPradio.com.
We're back. You're listening to 915 Talk.
We are back, and you are listening to 915 Talk. I'm your host, Andy Frecka. We are with Dr. Arshad Kaleem of High Desert Oral and Facial Surgery. We've been talking about reconstruction of the jaw from the fibula, reconstruction of the tongue from the soft tissue on the forearm. Am I getting this all right, Dr.
Yeah,
Kaleem?
you're already learning it.
I'm on my way.
Yeah.
During the break, you mentioned that these surgeries are done as a cooperation. They're done at UMC.
Most of our surgeries, yeah.
And then at the High Desert Clinic, you're doing things like the wisdom tooth removal.
Yeah. So implants and other procedure. We also see all these patients like for follow-up.
Oh, gotcha.
Surveillance.
Right.
Yeah. And just today, like we had the cancer surveillance clinic today.
Right. Okay.
Yeah.
Very cool. Very cool. So, Dr. Kaleem, you're not from El Paso originally, and you're not from the United States originally.
Yes.
Fill us in on your personal journey, how you ended up in El Paso.
Yeah. Okay. Well, that's a very long journey.
Yeah.
So I'm originally from Pakistan.
Okay.
Born and raised, educated in Pakistan.
Okay.
I've been in the States now for about, I would say, 25 years.
Okay.
Yeah. So my journey to the States basically began with my appetite for more specialized training, I guess.
Okay.
So I was a dentist in Pakistan already.
Okay.
Yeah, I did my oral surgery training too in Pakistan.
Mm-hmm.
But I wanted to come to the United States, and to come to the United States as a dentist and to practice, believe it or not, you have to go through the dental school again to fulfill the licensing.
From the very beginning.
Yeah. So basically, I had to redo my dental school and my residency to be able to do what I'm doing today. Yeah. So I have to kind of like do it twice. So
not just kind of, you 100% did it twice, right?
Yeah. So which I'm glad I did it.
Right.
But yes, that was a. So you asked me about my journey. So yes, that was basically the impetus was to get specialized training, high level of training that was offered in the United States. It's very well structured, and that is what I wanted to be. That what I inspired to be.
Yeah.
And that basically, I came. That's why I came to the United States. I had to pass a lot of exams and stuff like that, and go to school.
So you wanted to learn more. That was really what was motivating you. But
Right.
what is one difference between the educational system in Pakistan and the United States?
Yeah. Well, so I wouldn't say there was a lot of difference between education. I would say a lot of difference between the facilities. Also, kind of like the level of training. In Pakistan, we had a lot of patients that needed treatment, but we didn't have the resources or the training available.
Yeah.
So, and I think in the United States, it's very systematic.
Okay.
Everything is very systematic. There are a lot of resources available in terms of equipment, training, facilities, cutting edge technologies.
Yeah.
Yeah. So everything that we kind of like, when I was reading about these stuff while I was in Pakistan, most of the things I have never seen. But we were reading. But we were reading about it, right?
Oh, yeah, gotcha.
Yeah, we're reading about it.
Yeah.
I mean, talk about an article, a new article. We didn't have the means to even read the new article. It was just you go to the library, and the library will request it. Then you may get a copy of it like later.
Wow.
Right now, I mean, you type in, you have access. You read about new articles. You have access to everything. We didn't have that available. So I think it's just a lot of difference between the training. So
there has to be an absolute appetite for education to be in your field.
yeah.
And I mean, like, you have to always want to be learning. I assume there's always something new to be learned.
Oh, always. There's always. I mean, even at this stage, I mean, we're learning. I mean, you have to keep up. New technologies, new treatments are being developed every day, and I think it's we owe it to our patients to be up to date with the current knowledge and technologies.
Right.
Yeah. So we're learning and training, going to courses, conferences. Yeah.
I love it. When I lived overseas, when I would go to a doctor, this was actually how I tested them, because I was in some situations where we didn't have the healthcare that we have in America. If they said I already know everything, I would go somewhere else. If the doctor said I'm always learning, I said that's the place I want to be.
Yeah.
You know, with a doctor who's always learning. I love that appetite for education. What's one thing about Pakistan that you miss?
I would say family.
Yes.
Family. I miss my family because most of my family is in Pakistan, and I'm one of 11 siblings.
Oh, wow.
Yeah.
Okay.
I'm number 7.
Wow.
So I miss my family.
Yeah.
But I'm lucky that I do get to go and see them at least once a year.
Okay.
Yeah, I was just in Pakistan 3 weeks ago. And so went for a conference and some surgeries, and also spent time with my family.
Okay. So you're taking some of your knowledge that you've learned here and taking it back to Pakistan?
Yes.
Okay.
Yeah. Just like I trained here in the United States, I owe to the people here in the United States, I owe it to Pakistan too, because all training that I got in Pakistan initially was free of cost.
Right.
My dental school free.
Right. Was your training in America free of cost?
No.
Gotcha.
I had to pay a lot of loans.
Yeah.
I mean,
of course. Yeah. So what's one thing about Pakistan that most Americans don't know that they need to know?
I think Pakistan, I think it's an amazing country. I mean, they have everything in terms of like geography, deserts, mountains, amazing mountains in Pakistan. I mean, you're talking about 8,000 meter high peaks.
8,000 meters, so 24,000 feet plus?
Yeah. So Pakistan has like 7 or 8 of them.
Wow.
Yeah, if you talk about like there are 14 peaks in the world. 5. I may be mistaken, but it's 5 or 6 in Pakistan.
Wow.
Yeah.
Yeah, I don't think of the mountains when I think of Pakistan.
Oh,
that's great.
K2.
Yeah,
The world.
K2's in Pakistan.
K2's in Pakistan.
Yeah, it gets a silver medal for mountains, and right,
Yeah.
number 2.
Yeah.
Yeah, love it. So
it's beautiful.
yes. So after all these years, you've ended up in El Paso. Did you have a preconception of what El Paso would be like before you came here the first time?
Kind of. I mean, when you think of Texas, you think of like flat land, hot. That's what my impression of El Paso was. I mean, I had heard of El Paso, but I've never been and never thought I will end up in El Paso. And maybe your next question will be, how did you end up in El Paso?
Yeah.
So I'll just
tell me.
Tell you.
Yeah.
So I did my residency in Louisiana State University,
Okay.
LSU, and one of our partner, Dr. Werner Burke, he was in the same residency as he was above me. Like he was, I think he was graduating. He was in the final year, and I was just starting.
Mm-hmm.
And and then he decided to come to El Paso because he did some training in San Antonio.
Mm-hmm.
And when he was in San Antonio, I think he did some rotation in El Paso, and he thought basically this was a very good place to come back and practice.
Okay.
Yeah, because there was not a lot of oral surgeons. And so when he was graduating, he decided to come to El Paso. And when he was graduating, he said he knew that I wanted to become a head and neck cancer surgeon. He said, when you you finish your fellowship, why don't you come to El Paso? And I kind of laugh and kind of like who's going to go to El Paso? And I made fun of him, like, El Paso, I don't know. I've never heard about El Paso. In fact, that was probably the first time I heard about El Paso.
Right.
And then I did my training, I did fellowship, and then I went to Miami. I was in Miami for 5 years. And then I was kind of like looking for other opportunities, and then again, and every now and then, Vernon Burke, he was very persistent. He would send me a picture of a patient and say, this patient needs you here, this and that, and look, picture of the mountain. They say, look how beautiful El Paso is. And then before I came here, and my other partner, Dr. Hans Brockhoff, he's
Yes.
also head and neck cancer trained.
Yes.
And he had been here before me. He's been here now for 8 years. And I've been here now in June, this June 2025 will be 3 years.
Okay.
So he had been for 5 years. So he was doing cancer surgeries, and he basically started everything
Yeah.
here. And then he needed another person because he was getting busy. He reached out to me that if I would be interested to come to El Paso. I talked to him, and I talked to my wife, and we said, why don't we go? And we came here, and not just Dr. Werner Berg, also my other partner, Dr. Rio Pugao.
Okay.
Yeah, he was also an LSU grad. So both Werner Berg and Pugao were kind of like sometimes teasing me, hey, El Paso, remember this and that. I was like, okay, let's go. We came to El Paso. I liked it.
Okay.
I liked it. The mountains.
Uh-huh.
Very simple.
Yeah.
The weather. We came in February,
Right.
so the weather was very nice.
You like the February weather?
Or the February weather was very nice.
That's a good advertisement for El
Yeah,
Paso, is the
yeah.
February weather.
Yeah. So, so it was very nice. And then we looked at the practice. The practice is really good, and what we do from our practice, it's pretty unique. Doing head and neck cancer surgery from a private practice setting is very unique. Very few very few cities are able to do that.
Right.
And that was a unique opportunity that we are a private practice, we're doing head and neck surgery, but at the same time, we are also an academic program
Yeah.
because we train residents.
Right.
We also train fellows.
Right.
We have dental students from Texas Tech rotate with us, medical students from Texas Tech. So
Wow.
this was a very unique opportunity. We call it basically a hybrid setup, which is part private, part academic, part with UMC. So that was a perfect scenario, and I liked the partners, and then I decided, yes, we need to move to El Paso.
Love
Yeah.
it. So, as the El Paso envoy to Pakistan, what are you telling your family in Pakistan about El Paso?
Well, the farmland and the mountains.
Uh-huh.
Yeah, because from the region, the north part of Pakistan that I'm from, there's a lot of mountains and a lot of farmland.
Yeah.
Yeah. So I when I came here, I was like, believe it or not, there are farms and there are mountains in Texas.
Yeah.
And my partners, they have like goats,
Yes.
sheep,
Yes.
and cows.
Yeah.
Yeah. So which was
I
kind of
think
like
both Dr.
yeah.
Brockhoff and Dr. Yates.
Yes,
they,
yes, yeah. And Dr. Burke has horses too.
You okay?
Yeah,
Uh-huh.
yeah. So part-time farmer, part-time surgeons. Yeah. So
Yeah, that's great.
Yeah.
That's great. So I really want us to be able to jump into your volunteer work, your time on the West Bank, and also some of the patients that have come in internationally. So we'll take a break here, and we'll get back to that. We're with Dr. Kaleem of High Desert Oral and Facial Surgery. You can find them at hdofs.com, 915-504-6880. And you can just go for something like wisdom teeth, right, doctor?
yeah, anything they need.
Yeah. Do you do like fillings, or is that like below? Yeah.
No, I mean it's probably you don't want me to do fillings on you because that's not something I have
Because
done.
you'll take out my fibula and put it in? Or?
Exactly. Yeah.
Gotcha. No, but High Desert Oral and Facial Surgery, I do have the privilege of knowing a couple of the partners there, really good people, and getting to know Dr. Kaleem today. Again, hdofs.com. And actually, if you go to kelpradio.com, you'll find the link right there on our site. When we get back, we'll be talking more about your volunteer work. Do not touch that dial.
We'll be right back. Don't touch that dial.
Looking for a Christ-centered education that nurtures mind and spirit? Three Crosses Christian School in Las Cruces, New Mexico offers affordable quality education for K through 12th grade. Using the ACE curriculum, we provide an excellent academic foundation with a strong Christian worldview. Open enrollment is now. Our number is 575-382-4384, and our email is info@3ccs.school.
Are you looking for a Bible teaching church on the west side of El Paso? This is Terry Gray, pastor of Calvary Chapel, Sun City, and speaker on the Summons broadcast heard each weekday at 5 p.m. here on this station. Calvary Chapel, Sun City is located at 960 West Borderland Road on the west side of El Paso. We hold services on Wednesday evenings at 7 and on Sunday mornings at 9 and 11. You can find out more information about us on the web at www.ccsuncity.org. The Lord bless you, my friends. Hey, KLP listeners, this is Pastor Terry Gray of Calvary Chapel, Sun City on El Paso's west side. I want to invite you to join me at a new time at 5 p.m. Monday through Friday right here on KELP. If you're driving home at 5 p.m. or doing work around the house or getting your evening started, I invite you to join me as we go through the Bible, chapter by chapter, verse by verse. There is nothing more valuable than the Word of God, so let's invest our time in learning more about it together each day. That's our Bible study program, Summons, each weekday at 5 p.m. right here on KELP.
We're back. You're listening to 915 Talk.
And we are back. You are listening to 915 Talk, and I am your host, Andy Frecker. We're with Dr. Kaleem of High Desert Oral and Facial Surgery, and we started off the program talking about how the fibula is kind of like the not the most important bone in the body, so you can use it for your jaw if you need to. Then we were talking about Dr. Kaleem's journey to El Paso, talking a lot about what High Desert Oral and Facial Surgery has been doing. But we definitely want to talk about your volunteer work, Dr. Kaleem, because you were telling me that you were in the West Bank in the fall of 2023. Is that right?
2024, August of
2024.
Yeah,
so
a
not
couple
that
of months
long
ago. Yeah.
Yeah. So, well, I guess first of all, what were you doing there?
Well, I was volunteering and mostly doing surgeries in West Bank.
Okay.
Yeah.
What kind of surgery?
Any kind of mostly reconstructive surgeries.
Okay.
Yeah.
What was it because of the result of trauma related to the
Most of them were trauma related
Okay.
surgeries. Yes.
Okay, that's kind of unbelievable. I think for most of us who are maybe just driving down I-10 right now, sitting at home on the couch, what is West Bank like right now? How would you describe it?
Yeah. So, I mean, I went to West Bank. The goal was to go to Gaza or Gaza, which is commonly known as, but Arabic word for is Gaza.
Okay.
That was the goal, to go there. And
Right.
But as you know, August of 2024, middle of the war, it was impossible to go.
Right.
So the best option next was to go and help out was West Bank.
So was it patients coming from Gaza to West Bank?
No, as a Gazan, even before war,
Uh-huh.
you can't come to West Bank.
Oh,
Yeah.
I didn't know that.
Yeah, so it's a strange kind of like a system, and I'm also learning about it. Based on your location, you have a kind of a color ID.
Wow.
You have a green ID or a white ID or a blue ID, depending on which place you are. Especially if you're from Gaza, you can't go out of Gaza anywhere. You can't go to West Bank.
Gotcha.
You can't go to Jerusalem. You can't go anywhere. You are just confined to whatever this Gaza Strip is.
Right.
Either if it's for education or for healthcare or for any other reason, you have to get permission from the Israeli
Right.
authorities.
Yeah.
Yeah, and so that's the process.
Right. Yeah. So you wanted to go into Gaza, but it was impossible because of the violence. And you were just serving trauma patients in the West Bank, but they were from the West Bank.
They were from the West Bank.
Okay.
Yeah, so old trauma who had previous trauma. Most of them were like gunshot wounds, and some congenital, meaning birth defects and stuff like that.
Right.
Yeah.
Okay. So what motivated you to do this?
Well, what motivates any human being to go and help people in need? I mean, I think it's universal.
Right.
And my expertise is surgery. That's how I can help people.
Right.
And that's basically what motivated me
Yeah.
to just go and help out people in need.
Wow. Yeah. I guess you were just using the local hospital facilities, of course.
Yes.
And so what was that like after being in the United States all these years?
I mean, the fact that I've been in Pakistan, so I was kind of like prepared.
Right.
But if someone like who had been from like only in the United States and they have operated in hospital system here, it'll be a complete shock. And it was a shock for me to go there, like looking at the facilities that were basically very rudimentary, very basic. The workload is a lot. There are a lot of patients who are they're just waiting for being treated, to be seen. And everything, there's a lot of restrictions. Patients from one town and one city can't go easily from one city because they live in like remote areas and villages. If they have to come to like where we were in Ramallah in the hospital, they have to go through multiple checkpoints. So like a 5-mile journey could be 5 hours.
Right.
Passing through multiple checkposts and then coming. So these are the things that I saw was kind of like shocking to me.
Right. Yeah. What is something? I mean, I think for most Americans, we just watch the news. We see the images from Gaza Strip, but we don't really know what's happening there. we don't really understand the situation. What is one thing you would want the American people to know about what the Palestinian people's lives are like?
I think what I would recommend is getting to know.
Mm-hmm.
I mean, when you don't know about something, what you do?
Yeah.
You go read about it.
Right.
Open a book.
Right.
And put an effort and try to understand it, right?
Right.
So I would say educate yourself.
Okay.
Yeah, about the cause of the problem. What's the root cause of the problem?
Mm-hmm.
What is the struggle that Palestinian people are going through? Why are they going through? What was Palestine before there was Israel?
Mm-hmm.
The history.
Right.
And you have to just go through that, and you would understand, and you can make your own decision.
Right. Yeah. I think for a lot of people, I'll even say for myself, I knew so little about that situation. I still know very little. But when I was living in Russia, I did make some Palestinian friends. They were actually, most of them were doctors. And it was very interesting learning about their way of life. I don't think I wouldn't even pretend to understand the cause or the history, because it goes back hundreds, even maybe thousands of years. But I love what you said. Educate yourself. We shouldn't be afraid to learn more.
Yeah.
And just keep on learning about those situations. And, like we talked about medicine, always be learning.
Yeah.
And even, political situations that are happening around the world that we all have serious feelings about.
Yeah.
Yeah. But don't stop learning.
Yeah.
Keep learning, keep on getting that information. So love that, and I love that you're there just serving the people. You have other ways to spend your vacation time, I assume. So that's very admirable. Tell me about these patients who have been coming to El Paso.
Yeah. So also because some patients, the treatment is not available in Gaza, and one of the patient that we were able to bring to the United States through a foundation called Fajr Scientific, which I actually volunteered with when I went to West Bank. They were able to evacuate one of the child who's at the time was 12 years old. Their entire family was basically a victim of a bomb blast, being a missile attack on their house. Her 14-year-old sister and her young brother, her grandmother and her aunt, they passed away in that incident. And her little sister was under the rubble for I don't know how long, and she herself, the patient that we brought her, she lost most of the right side of her face, the soft tissue, the jawbone, and she was there in Gaza for 4 or 5 months. Whatever treatment was available, she got, but that was not the treatment that she needed, but they did what they could given the circumstances. I mean, the healthcare infrastructure in Gaza is decimated.
Right.
I mean, there is no functioning hospital, and so there are no facilities. So this poor child was basically there that nobody could treat. And through that foundation, I was reached out, and I said, yes, I can see her, I can treat her if we are able to bring her back here. And bringing her here was also a process, a long process. It took about 5 months to evacuate her through the State Department, through the Israeli government, negotiations, applications, and stuff like that. It didn't work. It came to the attention of a newspaper, Guardian newspaper.
Okay.
One of the reporter reported about her story, that this is a child who needs to be evacuated, and there is no reason to deny an evacuation or to permit this child to
For a
fly out of
child. Yeah.
to go and seek treatment. And I think after that things changed a little, and then she was only allowed to come with her mom. Her father was not allowed to come, and we were able to talk to one of the families here in El Paso. They're very good friends of mine. They're Palestinian, and they opened their hearts, their doors, their house to them, and they are hosting them. And I talked to El Paso Children's Hospital, and I talked to my partners and say, hey, is this something we can do? And we said, yeah, let's talk to El Paso Children's if we will be able to treat this child here. And I talked to Cindy Stout, the CEO of Children's Hospital, and she is gracious. She's very kind, and she said, yes, we can. And then we brought her here, and we did her surgery. She would require multiple surgery. We did her first surgery back in December. Right now, she's doing really well. At least she has she did not have a mouth, like a functioning mouth. She couldn't eat or drink without drooling, spilling food.
And I'm sorry if I missed this. This was due to trauma from the bomb blast? Or
Yes,
this was, okay.
from the bomb blast.
Okay.
Yeah.
So she didn't have use of her mouth.
Basically, yes.
Okay.
Yeah.
And so she comes to El Paso. Did you hear about this because of the newspaper article, or did you hear about?
I heard it before that because
Okay.
because of the foundation.
Okay.
Yeah. Yeah.
So she's in El Paso now. She's already had some treatment.
Yes, and then she would need further treatment. We're planning on it.
Okay.
Yeah.
Yeah. So how old is she again?
She's now 13.
13.
Yeah.
Okay. She's here with her mom, with a Palestinian family that lives here in El Paso.
Yeah.
El Paso Children's Hospital has been gracious to partner in that. It's been a whole group of people have come together. I mean,
Exactly.
it's kind of amazing to think Guardian. That's United Kingdom, right?
United Kingdom. Yeah.
Yeah. All these people from around the world for one girl from the Gaza Strip,
Right.
and this story is ending up right here in El Paso. Very interesting. So, how much longer will she need to be here for treatment?
Well, so I think she probably need a couple of surgeries. I would say it will take a couple of maybe another 2 to 3 years to fully rehabilitate her, because her next surgery is a major surgery, which is basically reconstruction of her jawbone. She's missing her jawbone.
Okay.
So we have to reconstruct her jawbone, and the free flap, the fibula that I talked to you about
Right.
earlier in the beginning of the program.
Yeah.
That is what she needs.
Right.
And that after that she would need other surgeries to provide her with teeth,
Yeah.
some implants,
Right.
and to rehabilitate her.
Wow.
Yeah.
Wow.
Yeah. So it's a long journey. It's a long process.
Quite a journey. Yeah. Are there other international patients coming in?
We had another patient come in who had who was a 5-year-old child who had a bullet lodged behind his eye.
Okay.
Yeah.
Wow.
Yeah. So the
Also
eye.
from Gaza?
Also from Gaza. Yeah, also from Gaza, shot in the head.
Yeah.
And he lost his eye, and he had a bullet, but the bullet basically is lodged in there. It's not causing any further problem at this time. I mean, one of
My
my
goodness.
neurosurgeons saw
Yeah.
him, and he said to just not do anything at this time.
Mm-hmm.
Of course, he has a non-functioning eye. Maybe he needs something done later to reconstruct his eye, but he's so young at this time that we'll just keep that eye for now. Should just kind of like help with the growth of the skull and the eye socket,
Right.
and then address it later on when he's probably in his teen.
Okay.
Yeah.
Okay. Wow. So, with all of this international experience you've had, growing up in Pakistan, getting a full medical dental degree in Pakistan, then getting a full education again in the United States, ending up in El Paso. Now you're traveling both to Pakistan and Palestine to use that knowledge to serve. But of course, you're here in El Paso with High Desert or on facial surgery. What would your dream be? What is one thing that you would like to see changed, that if you could change with a snap of your fingers?
Just a better and just word. Yeah. Justice.
That's it.
Yeah, I mean, as this is a Christian channel, and I also believe in Jesus, standing up for the oppressed people.
Yes. Yeah.
That's what I want to do.
Yeah, love it. All right, so we've been with Dr. Kaleem of High Desert Oral Facial Surgery. What a wide-ranging conversation. Have really enjoyed this, Dr. Kaleem. I love that you inspire me to learn more, to continue educating myself in all areas of life, both. I want to learn more about medicine now, but if I need help, I'll come to High Desert.
Yeah.
But also about what's going on around the world. Also, just this plea for our listeners to be compassionate to those who are in need. And you think of these children who are in need. I love the fact that you're working with those. High Desert Oral and Facial Surgery. You can find their website at keopradio.com. Their website is hdofs.com, 915-504-6880. I do have the privilege of knowing just a couple of the doctors there. Really good people. I love the fact that El Paso has this amazing resource of what a robust program to serve the community, and not just the community, the United States really, and the world, as we found out. And it's happening right here. Let's cheer them on there at High Desert. So again, Dr. Kaleem, thank you for coming in today.
Thank you so much, Andy, for inviting me and giving me the opportunity to talk to you. Yeah, thank you.
My pleasure. And as we always say at the end of 915 Talk, let's learn to love our city, love our neighbor, and give God all the glory. This has been 915 Talk. You have been listening to 915 Talk on KELP Christian Radio. To listen to past recordings of 915 Talk, just visit KELPradio.com and click on the 915 Talk link. Until next time, love your neighbor, love your city, and give God all the glory.